Hey folks, Chat Duplantis with Dentist in the Know, and if you don't know us, you should, because that means you're not in the know. But a company that is in the know is Solventum. And I'm here at the Solventum booth with Mindy Schulte. She's a clinical specialist for their Clarity aligners. And so I would like Mindy to first introduce herself and tell us a little bit about what she does with Solventum.
Thanks, Chad. I am, what Chad said, a clinical specialist in the Midwest region, licensed dental assistant for 30 years in the state of Minnesota.
How long have you been with Solventum?
This is my 8th year working for 3M/Solventum because it's been before Solventum was a company.
Let's talk aligners, but before we get into there, when we think of aligners, there's got to be something on the tooth to help move the tooth, right?
That's right.
And we call them attachments, we call them buttons, they're called a bunch of different things. Yours are precision grip attachments, and they're very unique. So tell us a little bit about these precision grip attachments.
What a great question. World's first preloaded, 3D printed, proprietary material precision grip attachments. And I'm going to use this great model because it's a blown up actual aligner for a patient. And what's great about this is when we use precision grip attachments, if you can hear the click with all the noise in the background, full engagement with the aligner, versus if you take an attachment that's got some flash around it from a conventional attachment, there's no full engagement. So think about how that tooth is going to actually engage in that aligner when we're moving that tooth for treatment.
All right, so one of the things that comes to mind for me is efficiency, consistency, and predictability. When we're using another aligner system and we're filling the reservoirs, you're not always going to get a consistent fill, you're not always going to get that predictability, and it can sometimes be inefficient. Why is bonding such a critical step beyond time savings?
You know, that's a great question as well. I always say this when I'm working with offices. What is the most important step of the bonding protocol? And it kind of opens the door to questions as the team, prepping or isolation or whatever. It's the step that you're on. The most important step is the one that you're on. And so you need to make sure that you're working on each step efficiently so that you have the bonding exactly right, the timing right, and with that, then your attachments will be bonded for the entire length of the treatment. Then the teeth will move effectively, efficiently, and if you're using precision grip, no flash, save some time.
How does one bond the attachment to the tooth from the tray?
In orthodontics or in dentistry, you'll do a phosphoric etch, you'll do a primer, and then chair side, you're actually going to put another primer on the base of each individual attachment. I call it a raindrop. You want to make sure you have enough of a primer. You're going to insert it into the tray. I always talk about just making sure that you're holding that, light curing it. Once you've finished light curing everything, you're going to just take it out. This scaffolding or handle is going to click away from the attachment, and everything is bonded on the patient's tooth.
Yeah, is it Scotch Bond Universal?
On the tooth, it is the self-etching primer, Transbond self-etching primer. What you're putting on the base of the attachment is our Transbond XT primer.
Let's talk a little bit about movement mechanics.
With and movement mechanics, because there's no flash, teeth are moving more effectively.
I'm going to go off script here.
Okay.
All right. Because I mean, obviously I'm intrigued. Everything about it is fantastic. Is this system open to orthodontists and dentists?
Yes.
Okay. All right. So the second question is, I'm a dentist looking to get into clear aligners, specifically Clarity. How can I become trained on this?
Training is your clinical specialist, me in the region that you work in, working with your sales rep, your clinical specialist. If you're a dentist, there's another factor, which is your inside sales digital specialist as well. We all work very well together. The training itself is whether virtual, depending on how close I might live. I come to your office, we'll do the training, but we can also work through Teams. It just depends. The sales reps could come in and we'll do a lot of stuff in person, but also virtual. It just depends on what's happening.
Okay, and the third question.
Yeah.
And this is the one that I think most dentists will want to hear. How are these cases treatment planned?
So we have a very robust training program for our treatment designers. We call it a treatment design. And we have humans that touch every case. In each region, there is a handful, I like to say 5 to 7 technicians that will ever touch that case.
Okay.
And so a human is going to work on that case back and forth, however many times they revise. And that's how that is set up.
That is probably the most important factor, because if it's not set up properly, we know it's not going to work. I love the way that you all do that. I love that there's back and forth. There's the ability to communicate. The doctor has a lot of input, it sounds like.
That's correct.
And so I guess my final question to you is, why should someone consider this ecosystem over the competitors?
Because it's the best.
I love that answer.
Preloaded, 3D printed attachments. People have been asking for preloaded attachments forever. They're here. Sign up. It's free to sign up.
Okay. Mindy, thank you so much for your time. I think if anybody could educate on this service, it's you.
Thank you.
You did a fantastic job.
Appreciate
Keep
it.
it up. I'm looking into Clarity Aligners.
Fantastic. Thank you so much, Chad.
Thanks.